As instances of police violence continue to spread across social media.
What started out as a mental health call turned into a man being shot dead.
And the Black community deals with the trauma of what seems like an endless stream of videos. Some people are stepping up with new support services. After the death of Mike Brown in 2014, community organizer Vanessa Green started Call Blackline, a hotline to answer Black people's cries for help.
Black people need a hotline. We started Call Blackline really in Newburgh. The number was an 800 number, but we were just centering Newburgh.
Then the hotline in Newburgh, New York turned into a national line. Now they even receive calls from Canada.
Calls range from lonely Black people in their home, right? To I have folks who call who are schizophrenic, so it's a range of calls, a range of problems. And then the uprising hit. Goddess. Then the calls probably went up from a couple of hundred a month to over 1,000.
Due to the lack of funding, the 24/7 hotline only has 15 volunteers, 2 per average 6-hour shift. Tanya Connor Mitchell is one of those volunteers.
I want to show you the picture of me and Vanessa. This was at the march. It was a march for Black women. People's mental health is real. People struggle, anxiety, depression. And when you call the hotline, the suicide hotline, that's all they want you to talk about. Not the fact that you had a messed up day today, or you were called a today, or so they couldn't call there. We needed our own. Hello, Blackline.
They trying to cover it up.
I'm so sorry that happened to your nephew, but it's up to you and the community and those who cared and loved him and just us to bring that to light, because that's not how it's supposed to be.
And that's what they think. That nobody cared.
Right. Most times, again, people just want you to listen. So you're going to pay a therapist. You don't have the money to pay a therapist just to listen. So you call us and we'll listen. And then it keeps our people safe to be able to call us and to talk to us, as opposed to what is the other option, which is 911.
Common types of 911 calls that advocates say can be handled better by non-police alternatives include those regarding mental health, domestic disputes, and housing-related issues like noise complaints. Some organizations have even created guides with different resources to call instead of 911 in those situations.
I do think that there's an over-reliance on police and on calling 911, and I think that many law enforcement officers would agree that they get called for all sorts of situations that are not urgent public safety challenges. We've known for a long time that there's well-founded and deep-seated mistrust of police officers, particularly in communities of color.
A few hours from Tanya's home, Albany County Sheriff Craig Apple says his team is testing out a new program to answer non-criminal 911 calls.
And we have mental health teams that now go out on the street for those calls that aren't, quote, the emergencies that need the police and the deputies there right off the bat. And those calls include emotionally disturbed persons, threats of suicide. So instead of just dialing 911 and we would send an EMT and a police officer, now we could send this team in. It's a social worker and an EMT and or paramedic.
How do you spell racist?
Many are now demanding departments be defunded.
It's not the time to also be talking about defunding our police. We have an uptick in violence in our community here in Albany County, New York. We still need our police officers.
As for organizations that don't feel law enforcement are the best equipped to respond to certain calls,
I think when you start to cut out police, it's problematic. They need to be there. They need to be present. They need to be part of the conversation. And many times I see folks, advocates, that are like, we can do this. We don't need police. We can handle this ourselves. You need to have police involved. And that way we can also show the community that, listen, we want to work with you. We want to help you. We want to be part of the solution, not part of the problem. I'm very leery of having law enforcement cut out of the equation. I just think that could lead for a recipe for disaster.
So what would you say to people who say, how are you guys going to be able to handle calls that require emergency services or something like that?
Like if somebody is shot or if somebody broke their leg, they know, go to the hospital, call 911.
You're saying pretty much for anything that's not a medical emergency?
Medical emergencies is 911. We never say call us if, you know, you need stitches. But if you need someone to talk to or someone to help you, we can give them resources and people to call.
But of course, there are circumstances between emotional support calls and medical emergencies. Robberies, domestic violence. Tanya says that even in situations involving crime, many are hesitant to call the police, fearing what may happen when they show up to the scene.
When your job is based on looking at me as if I'm a criminal at all times, no matter where I am, who I'm with, that's a problem for me.
For example, in Albany, they have this program that they're piloting, hiring mental health specialists and social workers.
Good start. They need to do much, much more before I can trust them. And I definitely speak for my community because we don't trust them. We just don't. And we have all reasons not to. It's easy for you to tell me that I need to get over it and you've never been, you know, it's not you. It's not your people. It's not your race.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.